All right, now when we talk about ICD-10 for obstetrics, there's ICD-10 obstetrics, and it is a whole chapter. And then we have ICD-10 obstetrics chiropractic, which is very little bit, okay? It's not a lot. So I just want to kind of give you some rules. And again, as I was telling somebody during the break, you know, we have all these rules here, but the rules are going to be changed as time goes on. I can guarantee you the way you practice now, that October 2nd you'll be practicing different, okay? And the way you are documenting and coding and practicing October 2nd will be different than you document and code October 1st, 2016. All right? Now, this is just a Mario thing. This is my opinion, okay? And so whatever it's worth, take it for the opinion. But I thought of this when Parker was talking during lunch, and I thought, you know what, I'm going to tell my staff too, I don't care if I'm present October 1st or not. Yes, you want to get all your billing out, but I will tell you that I will probably, in my office, and hopefully everyone agrees with me and you don't disagree, I'm probably going to not file any claims to anybody October 1st, which is a Thursday, and October 2nd, it is a Friday. Because I think everyone is going to be, if there is going to be a time where, you know, it's like Y2K all over again, all right, it's probably then, all right? And it's just like if you liken it to at the beginning of the year, think about the way the government acts. And this is not political stuff, this is just business stuff. You know, this actually came up in our meeting with Medicare that I had a couple weeks ago. And that is, and this is the way it was put, and this was put by a medical doctor. Why is it that Medicare cannot release the new fee schedule in December? Is it ever going to be in December? Because you don't release it until January 16-ish, and therefore we have to hold our claims until then, right? And basically, Medicare said, we have nothing that is on the books that says we'll release it any earlier. Okay, it's the government, all right? Do you feel that when changes occur, that everything will be in place, solidified by October 1st? Okay, I think the insurance company, you know, the rules as I'm teaching them to you, is that going to change by October 1st? No. The rules are the rules, all right? Everyone else has already been using it since 1995. I mean, we're just latecomers to the game. But as far as systems are concerned, testing your systems, everything else, yeah, test everything. You know, through the H&S Connect, through Medicare, whatever. But you know what? If things are going to blow up, it's probably going to be October 1st. So, you know, we hold our Medicare claims for the first couple weeks in January every year because it's until everything washes out. Who's to say, why don't you wait a couple days at least till, you know, October 4th, 5th to just see if the world blows up, you know? I mean, we might be bartering eggs and cheese by then, who knows, okay? All right, so the key is, and that's just my opinion, but it's something to think about anyway, is maybe, you know, I would talk it over with my wife, and I just say, why don't we hold off and just not file anything? We file electronically. Let's not file anything for the first couple days. Let's just see if any glitches show up in the system. I would rather have some of you go through the glitch and then I learn about it, okay? Rather than I say we filed it, this was a glitch and we lost, you know, a whole bunch of claims. So that's just something to think about and do what you want. But you know what, we do it with Medicare all the time, and maybe you might want to consider that. And I'm not saying forever, but just for a couple days, just see how things go. By Monday, you'll know. You know, if you look out and it's like, wasn't there a building there before? And, you know, it's CMS and it imploded, you know what it is, okay? All right. So now, when it comes to obstetrics, instead of teaching you, you know, it was kind of heavy duty on chapter 13. 15 is not so heavy duty. 19, it's heavier. And then 20 is just fun. Okay, so let's talk about 15. Number one, this is kind of like if it was just us sitting having coffee here, and you said, Mario, what do I need to know about obstetrics? This is what you need to know. Number one, patient comes in, and they say, I'm pregnant, okay? And you go, was it planned? No, you just say, when are you due? All right, and they say, when are you due? Now, you can write down the due date, but nobody cares. Because the due date, it's really of no consequence for coding. So therefore, this is what I already do. Now, literally, if you were to text Laura in my office now, and you say, when a pregnant patient comes in, what do you put into the notes? And she will say, patient enters the office today for a follow-up appointment. And by the way, you never write checkup. Checkup denotes wellness care. Follow-up is do this, do these exercises, use ice. Okay, see me on Tuesday. I want to follow up with you. Okay? Now, that's not any carrier, but that's just documentation lingo. Checkup denotes wellness care. Follow-up is a follow-up appointment, active care. Okay? All right, so just neither here nor there. So therefore, it's like, okay, fine, how many weeks pregnant are you? And we write it down or put it into the EHR software. It would be kind of nice if I had my way that the software would just calculate that. But the reason is because your codes are going to be dependent not on when their due date is, because when you think about it, what's the real due date? When the baby comes, okay, or when the doctor does a C-section. All right? If your child is due on July 4th, believe me, you're not having the baby on July 4th if it's a C-section. It'll probably be the 3rd or the 5th, right? My daughter, youngest, was born on the 5th, but that wasn't the date she was due. So when you look at the trimesters are defined as such. And this, they've actually gone through and are much more specific on it. Less than 14 weeks, 0 days is first trimester. Second trimester, 14 weeks, 0 days to less than 28 weeks, 0 days. Third trimester, 28 weeks, 0 days until they pop, okay? All right, so trimesters are counted from the first day of the last menstrual period. First day of the last menstrual period. Because the last day of the last menstrual period is variable, but the first day of the first menstrual period, they usually know when that is, okay? So if you ask them, everybody, the medical profession is already using how many weeks gestation you are, all right? So in your office here, I highly recommend that you just get used to it now. Because if you train your staff to do this, and if you don't have somebody come in the room like I do, and I'm blessed with that there, but that's just CMS taking a picture of everybody in the room, okay? All right, okay. All right, so shh. Okay, you guys don't tell them if that one blows through. Okay, so, all right, so where was I? Okay, I forgot now what I was saying. But the key is that with your patients here, I was going to say, if you ask my staff, why do you do that? Why do you ask how many weeks gestation, how many weeks pregnant they are? And if you don't have the staff like Laura to come in there, usually you have somebody that brings the patient back to the treatment room, right? All right? So in my office, and I will tell you this already, okay? In my office, this is not going to come out right, but I'll say it. I hate asking the patient what their pain levels are for Medicare, all right? Because I'll ask the patient, and I'll say, okay, if 0 is no pain, 10 you're in agony, what are you at? Well, it's the same as I was last week, and it's about 2 more than I was in 1942, and it depends, what were we doing? Oh, just give me a number, right? Okay, right? You just want to grab them by the throat. So I have a true family practice, okay? My youngest daughter works part-time in the front desk, all right, at the front desk. My oldest daughter works full-time in rehab, even though we sent her to college for something else, but she didn't like it. So, now she works rehab, and she's very good at it. She's a certified personal trainer, certified running coach, and she works in our rehab department. And Dr. Ponica has her master's degree in sports science, okay? So when Katie brings back a patient, she asks the Medicare patient, if 0 is no pain, 10 you're in agony, what is your pain levels? And then she'll say, is it dull, sharp, stiff, whatever, okay? So when I walk in the room, it's already done, all right? Now, Rhonda, who works when Katie's not there, asks the same questions. So you can have your patients ask the same, your staff ask the same thing. And have them ask for the pregnant patient, number one, the protocols that I set up. That's your policies and procedures. Set it up now. Train your staff, okay? And so once you do this now, policies and procedures, protocols, October 1st, it's already, you don't even have to worry about. It's not like Wednesday do this, but Thursday start doing this. That's one less thing you have to change on Thursday. And so, and when they bring a patient back who is pregnant, okay, there will be a medical alert in our dashboard where it comes up on the computer, all right? Maybe you'll have a medical alert sticker, the patient is pregnant on the chart, the file. And so that should tell them, ask what week pregnancy you are in, and then get the blood pressure. Those pregnant patients, you should always get blood pressure every single visit, okay? All right? If you're not doing that, you should be doing that. All right? Okay. So the trimesters, you define it. So I'm giving you some tips as far as how to transition into your office there. And so find out what week gestation they are. Okay, now, here it is. Everyone write this down here if you don't know it. But the Z3A codes are really important. So it's not in your notes per se, but this is just listen to me and write down what you wish. Z3A is always a secondary code. So Z3A, so it would be like the helpful tips, P&M tips, Parker and Mario, okay? All right, okay. So, and Steve, okay, we'll let him in too, okay? All right, so you put Parker, Mario, and Steve, then it's the PMS tips. Okay, all right, okay. Hey, you set yourself up for that. Okay, all right. Oh, don't get in a bad mood. Okay, all right, okay, no, I'm just kidding. All right, okay, so the tips, all right? Number one is you're going to find out what week pregnancy they are. And number two, all right, again, tips with obstetrics, is the Z3A code is only, this is important, only used for a complication of pregnancy. All right? So Z3A is always a secondary code, and number two is always a complication of pregnancy, okay? Let me give it to you in ICD-9 world, which you may or may not know, and then I'll put it in ICD-10, okay? ICD-9 world. Patient comes in and says, "Oi, my back," okay? All right? And they're grabbing their back. So you put down 724.8, facet syndrome. Okay, pretty soon, because the patient's only 3 months pregnant, pretty soon you get questionnaires, when is this patient going to be released? All right? Now, I like when they have pain with their pregnancy because when are you due? June 12th? June 13th, you'll be fine. Okay? I can pretty well predict it. All right? But the reason why you're getting those questionnaires, most questionnaires are probably because you're using the codes wrong. So if you don't know this code, you can use this starting today, is 648.73. 648.73 is lower back pain due to pregnancy antepartum. Antepartum. That means they haven't given birth yet. 648.74 is lower back pain due to pregnancy postpartum. Postpartum is usually like L3. And why do they have that pain? Postpartum. Epidural. Okay? All right. Okay. So, 648.73, 648.74 are one of those codes that does not translate very well into ICD-10. Okay, I think I have it in, let me see if it's, yeah, there it is. By the way, you see look at this code right here, O33.0. Do you see that? Okay, O33.0 is the equivalent of the 648.73 code. So you can put them all together if you want to. ICD-9, 648.73, 648.74. The O33.0 is maternal care for disproportion due to deformity of maternal pelvic bones. That's a mouthful. But that is the closest to those codes. Now, the problem, and let's use this slide here, okay? The problem is the O33.0. All right? And so therefore, since the problem is directly related to the pregnancy, I am going to give a Z code with it. And the Z code is a Z3A point, a number. And the number corresponds to what week of pregnancy they are in all the time. Okay? Everybody got that? Hopefully you do. So a Z38.21. Now, if I told you that they were 32 weeks pregnant, then I would put down an O33.0, and what code will go underneath that? Z3A point 32 weeks, 32, okay? So if they are at 35 weeks of pregnancy and they're having a lot of problems, and I told them, I'm going to see you weekly now until you give birth. So let's say week 35, it will be O33.0 and a Z, week 35, Z3A.35. I see them weekly. So yeah, that means the next week they come in, they're going to have an O33.0 and a Z3A.36. And you will literally have to change it every single week. Now, out of the codes that we as chiropractors use, that's going to be very few of them, but this is one of those examples. So you'll want to, because if the code stays stagnant, it may lead to questionnaire or audit. Okay, everybody with me there? Now there are other codes, and let me just give you an example because I don't want to go there, especially we don't need to at this point, but what other codes might there be present? Well, there are codes if the mother is smoking with pregnancy, and I actually have a patient right now, I've talked to her about it, she's still smoking with pregnancy. There's a code to denote that, and that goes in the third code slot, and that says that she's smoking with pregnancy. There's another one for alcohol consumption with pregnancy as well. All right? Now, as chiropractors, are we going to have to report that? I don't know, and look for carriers. They may want that data there, and so they might tell you, and that's where one of the things, I don't see it happening, but I don't know, all right? What I do know is that if it is a complication of pregnancy, so let's look at it this way. If it's a complication of pregnancy, using this code, the O33.0, will get them off your back, the insurance company, okay? But you'll have to use the Z code with it because you're saying that it's due to their pregnancy. Everybody with me? Yes? Okay, all right. Okay, so that's what this here, the Z3A codes there, okay? Codes for unspecified trimesters should never be reported, okay, unless it's impossible to determine the trimester from the medical record documentation. You know, on occasion, you know, it's kind of like I started having cramps and I went to the hospital and I had a baby. I didn't even know I was pregnant, right? They find out at the last minute. Does that happen? Yes, but not that often, okay? Because then that way they can't have a baby shower. Okay, all right, so, all right. All right, so, all right. Okay, so self-test. The patient is seen for her routine visit during her 7th month of pregnancy. She's 28 weeks, 3 days. What is the secondary code for her visit? Okay. Very good. Z3A.28. Good. What trimester is 14 weeks, 0 days? What is it? First. Very good. Okay. All right. Okay, now, the next question. Okay, do you feel like this? Okay. All right. All right. Just had to put that in there. Okay. All right. All right. Except for the ones that were out in the lobby, they're still wondering, what was all that screaming in the room? Okay, all right, okay. Chapter 19 is going to go a little quicker because we've covered some of those rules in the general rules here, okay? But chapter 19, most categories in chapter 19 have a seventh character, A, D, and S. Now, I gave you definitions of A, D, and S before, and just to confuse you more, here's some more definitions. By the way, all these definitions that I gave you earlier of the Lenny codes and the ones I'm about to give you are from the same book, but yet they contradict each other. Because it says here in A, look at that, evaluation and treatment by a new physician. Before it said a new condition. Now it's new physician. So you can see there's some confusion there. All right? So stay tuned. I promise, as soon as I find out, okay, my office will be the first ones to find out H&S, I promise, and I don't work for H&S, but I'm happy to help you guys here. We'll let Parker know, okay? And she can put it on her, on the website. Okay, so seventh character, A, is for, look at it like initial encounter. Now, do you see this in your notes? Everybody, you with me? Okay, so in your notes, where it says used for initial encounter, just somewhere next to that slide, put down in Medicare active care. In Medicare active care. So Medicare is using it mostly for active care, okay? The D is the healing or recovery phase of care. Examples are this care is for cast change, medication adjustment, or other aftercare. But for chiropractic, and so next to this one, put in parentheses, if you will, next to this slide here, may not be used in Medicare. Okay? Medicare doesn't have any D codes actually in there. And then the S, that's a sequela. And so now, there's actually quite a few S codes along with in Medicare, okay? All right, okay. Now, I'm going to give you a synopsis of this because we've talked about this, but now we come to it, and so I want you to, just put little notes to yourself, and that's really what notes are all about here is I tell you it, you're going to listen to it, you're going to forget it tomorrow, okay? So now you want to write notes, and so coding complications of medical care or treatment is entirely dependent on the physician's documentation of the relationship of these, okay? So whether it's a sequela or it's a primary problem, that is really up to the physician to determine it. So in some instances, degenerative disc disease might be the problem. In other instances, degenerative disc disease might be a complicating factor. In other instances, it might be considered a sequela. So depending on how the doctor says this is what it is, and then how the carrier determines that is all up for interpretation. And I know it's kind of confusing. That's because we don't know yet. And when it comes to AD and S, that's where we really don't know, okay? So the key is doctor, you have to document. And yes, you document it there. This is what I do. And again, just to help you out, okay? Assessment is one of those things where how do you document it, okay? Now, in my office, and this is just me, I'm not saying for you to do this here, but in my office, I taught Laura and Nicole as well, I taught them, when I tell the patient what's going on in their case, that is my assessment. And if you think about it, it's a professional judgment, okay? So, as an example, assessment. I will examine the patient, adjust the patient, and then I'll tell the patient, you're doing a lot better. Because most patients think I'm not getting better. And I'll say, the stiffness you feel is really, the tornado's gone, but now we have all the damage to clean up. So the stiffness is still some of the muscular problems, so I want you to continue with stretching and use some heat on your neck, okay? Very simple, but nonetheless an example, all right? So in the note, the assessment is that patient is improving as expected. The patient is improving with decreased edema, but still has muscular involvement. And then the recommendations were for them to use heat and continue with stretching exercises, okay? So sometimes it's like that computer gets between you and the patient. And so when I explain to the patient what's going on in their case, probably that's why I have, I think, a pretty good compliance record where patients follow through on their care. I don't keep them coming forever and ever, but I don't have them drop out because most patients will drop out of care after about 4 to 7 visits, and it's because they're feeling better. But that doesn't mean they're well, all right? And it's not about the visits, it's about the care. Because when their pain comes back, they're going to say, I went to a chiropractor, but it didn't work. They never say, I didn't follow through and didn't keep all my appointments, okay? So the whole thing is that when it comes down to documentation, doctors, you have your professional opinion, and that's really what the assessment is. That is the medical decision making. And so that's why your documentation, you have to be a doctor. Back in the day, I think back in the 60s, 50s, the doctors did house calls. They came up, did a house call, and how many patients did they see a day? They didn't see 50 people a day. They might, maybe on a busy day, saw 10, right? But they came to your house, and then they start saying, no more house calls, and now we're going to do home visit, and then everything changed there. But we still have to spend time with our patients. We still have to educate and explain things to our patients, right? Okay, so the education, part of that is writing down documentation and explaining to the patient that is your assessment. And so when you look at this here, doctor, you know what's going on. So your assessment, is this a problem or is it a complication of the problem? And you could, any patient you're thinking of, you can answer that. Just put it in your notes. And that would be a good thing to put under the assessment part of your note. Well, now staff, you should, and train your staff if they're not here, you got to look at that and then determine, is this an S or an A or a D code? And that's where it's going to be different in the documentation and coding under ICD-10. Now, injuries, under Chapter 19, that's injuries, sprains, strains. Now, those injuries, when coding injuries, assign separate codes for each injury unless a combination code is provided. I already told you that, okay? The code for the most serious injury, the worst, goes first, okay? So I'm going to go a little faster, but it's because we already talked about this. Superficial injuries, remember, if I fall off the stage, break my hand, then the edema, the abrasion is secondary to the fracture, so you code the fracture and you don't care about the abrasion. Same with the primary injury with damage to the nerves or blood vessels. What trumps everything? What injury trumps all other injuries? Nerve, okay? Nerve, by far, all right? Okay, so what are the 3 7-character extension codes? What are they? A, D, and S. What extension character is associated with healing or recovery phase of care? A D, all right? Okay, all right. So, I don't know why I put that picture in there, but I just did it. Okay, so that's Ginny with Elvis, okay, last week. Okay, all right, okay. All right, so let's not keep you hanging in the tree here, so I'm going to help you out, okay? You ready? Okay, little fun time. Just look up here and just let's do some coding here, okay? All right, so combination code is a single code used to classify 2 diagnoses or a diagnosis with an associate. I know this isn't in there, that's why I said just look it up. It's kind of like workshop. Combo, okay, would you like a combo with that? Yeah, a combo code, okay? All right, so patient enters the office today complaining of pain in the lower back and leg. She reports pain for 1 month duration. Pain is in the posterolateral aspect of the leg with radiation into the foot. Okay, so now, non-staff, the SLR is straight leg raise test, positive at 45 degrees. The reflexes are diminished here, and so we were basically telling you it's a sciatic problem, okay? All right, so what is the appropriate code based on the documentation here? Okay, so is it unspecified sciatica? No, it's not. Because this is pain in the lower back and leg, this is an example of a combination code that you're going to see often, and so therefore it's sciatica with lumbago, unspecified. Ooh, not good. Shame on you. Bad doctor. Okay, all right. Because look, what number does it end in? 0. Okay, that's your reimbursement rate. Okay, all right. So now you go back to your doctor, okay, and you look at your doctor and you said, do you remember when we took Mario's class? He had me look at you and say, don't waste my time, okay? You're wasting my time, okay? Which leg is it? Okay, and they go, okay, so patient enters the office today complaining of pain, lower back and right leg. She reports pain for 1 month duration. Pains in the posterolateral aspect of the leg with radiation in the right foot. Okay, so now what is it? Okay, is it sciatica, right sciatica? No. Okay, very good. There you go. Yeah, it's sciatica with lumbago on the right side. It all comes down to the documentation. It's not about the base, it's about the documentation. Okay, it was a song. Okay, anyway, all right. Okay, now, this we don't know, but I'm just going to kind of tell you. Patient returns today for a follow-up pertaining to ligament injury, so it's not the first visit here. He stated his pain has decreased to 4 out of 10, sharp and constant, okay? So diagnosis, 723.3XX, and so what are the choices? What are the choices at the end there? Could be an A, a D, or an S. So based on what we know so far and the documentation, what code goes up there? What is the character, the ordinality character? Okay, well, based on what we know now, it's a follow-up. They're in the middle of their treatment, and therefore it's not the initial encounter. So what we know now is it'll be a D. We don't know. I said based on what we know now, according to the definition, it is not the first encounter. But that, again, okay, I'm just showing you the follow-up visit here, okay? But that, again, we don't know. Okay, we just don't know. All right. Okay. All right. Any questions so far? All right.